This is how you cross over from Israel to Gaza. And right now we're in no man's land.
Prime Minister, do you now regret when once asked what your favourite joke was, you replied Nick Clegg? And Deputy Prime Minister, what do you think of that?
Mr. Trump, why should you be president? What makes you fit for the role? Is it just one big ego trip?
Thank you very much.
People aren't sure they can trust what you say. You say things and then it turns out that they're not quite what you said. My name's Andy Bell and I've been a journalist for over 30 years with the BBC, Sky and ITN. In this podcast series, How Did We Get Here?, I provide context and background to a big story in the news by talking to someone with real insight. For this edition, as we dare to hope that we are moving out of the pandemic, what about the 1.3 million people who suffer from what's now called long COVID? Is their condition recognised by doctors, employers, politicians? Is enough done to help them? And what could the long-term impact be on the NHS? I've been talking to Claire Hasty. She's the founder of the Long COVID Support Group, and with her family, she continues to live with this debilitating and little understood condition. Claire Hasty, thanks very much for talking to us for this edition of How Did We Get Here about long COVID. Can I start by asking you what has been your personal experience of COVID and then long COVID?
So my children and I fell ill in March 2020 and are yet to recover. I'm a single parent and my then 15-year-old had to become our carer. He also had symptoms, but thankfully his were just the rather bizarre COVID toes that you may have heard of, where people's toes turn a rather alarming shade of purple and indeed blackening, and they can blister and be very painful. But actually he felt fine in himself. He just had very bizarre coloured feet. So he had to learn to cook and do all the things I've been trying to make him do for years, but he wouldn't help. He had to do because I was bedridden for several months, and his 11-year-old twin brothers were also really ill. And the three of us, my younger boys and I, are yet to recover.
So you were bedridden for several months, and did you, when you went to the doctor, or when doctors talked to you, did they start talking about something called long COVID, or had anyone heard of it then?
No one had heard of it. So I actually set up a Facebook group at the beginning of May 2020 to share information and support with other people who were failing to recover, and pretty much immediately started taking to Twitter, which I'd not really done before, to campaign for, we had a 3-word slogan, rehab, research, recognition, because we were completely invisible. And in fact, although we've come on an awful lot since then, we are still invisible in many ways. But just to go back to how it affected us, I have ended up being registered disabled and having to use a wheelchair. I used to cycle 13 miles a day on my commute prior to falling ill. My boys miss a lot of school. One of them had an EEG all last week investigating suspected seizures that he's developed over the last year or so, seemingly in relation to long COVID, because we know that's quite common. His brother has awful gastro issues. Sickness and diarrhoea it's one of his big symptoms, and joint pain, excruciating joint pain. So they, thankfully, they relapse and remit. So they'll have a few weeks of feeling completely fine, and we keep thinking that's it, but then it comes back again. And then we were reinfected. I think my younger boys are on their 3rd infection now, and I on my 2nd.
So you're registered disabled. So what's your condition now?
So, I was also unable to work for over a year because of the cognitive effect as well as the physical symptoms. I returned to work about 8-9 months ago on a part-time basis, and I don't do my former job because I don't think I have the cognitive capacity that I had. I can't concentrate enough, and my short-term memory is really changed, and I'm unable to multitask or juggle more than one thing at a time in a way that I could a bit more before. So now I work from home, and I work three days a week with hours spread across the week. My employer thankfully has been very accommodating, which is unusual. I think a lot of people have actually lost their livelihoods as a result of this. And on good days I can walk short distances on the flat now, so I don't use my wheelchair all the time like I did for over a year.
And you would describe yourself as a healthy person. Did you have any underlying conditions before? No,
myself and my children, we thought we were completely healthy before, fit, active, very busy. And in fact, that's something we see a lot in our Facebook group and I actually wonder whether there may be a pattern here that we see a lot of people who were very active before, either in their jobs and or in terms of being athletic. So we see marathon runners, we've got triathlete, former Commonwealth Games triathlete in our group, people who are competitive cyclists, rowers, judo practitioners, etc. So it does almost make you wonder whether people who were used to pushing themselves and kind of really living a high-octane life were more likely to get long COVID. I don't know.
Well, we'll return to some of that, but I just wanted to also go back to when you went to doctors for the first time. What were they thinking? Did they have any kind of sense? I think you said May 2020. Did they have any kind of sense of what they were dealing with?
Well, we fell ill in March, actually. May was when I set up the Facebook group. I went to A&E 5 times, each time on the advice of 111 or a doctor, and several times thought I was going to die. I've just never had an illness like it. And at the time, this was just coming up to the first peak, and it was very much the message was stay at home. So I went when I was really desperate and literally thought I was not going to make it, but was turned away. Well, they tested my oxygen and they said your oxygen levels are fine, and I think that seemed to be the main prerequisite for being admitted. And I didn't want to be admitted because I knew they didn't know what to do with us. So I was told to go back home and not come back unless my lips turned blue or my heart pain became unbearable. And I think a lot of us were told that, and I do wonder how many people lost their lives because of that, actually. So A&E was my port of call. My GP got in touch as a result of me having gone to A&E and was great from the beginning in that she treated me like a grown-up and said, look, I have no idea how to help you. You know more than me through your Facebook group. So again, I think I'm unusual in that. I think a lot of people have been disbelieved by their loved ones, by their employers, by their medical practitioners. And as for the term, we were actually instrumental in creating it. It was first coined by Dr. Elisa Perigo, an Italian archaeologist actually who's active on Twitter and who we connected with. And she used the term in a tweet. And we thought, oh gosh, that's just the perfect way of describing it. So kind of jumped on that hashtag and pushed it and pushed it and pushed it. And now it's used all around the world.
And when was that long COVID? When was it first used, or when did you become aware of it?
Well, we saw the Elissa's tweet in, I think it was May, early May.
May 2020. I mean, is there a set of symptoms that you can now say, that is clearly long COVID, or is there all just a sort of range where it's very difficult to categorise?
It's a huge constellation, and there is now a NICE guideline, clinical guideline, and it does its best to define it. And there are also guidelines from CDC in the US and World Health Organization, and it's incredibly difficult to pin down. So there are some that are more common than others, but there is a list of over 200 symptoms, and they can evolve. So symptoms can develop even months on, even when people thought they'd completely recovered from the acute infection, or indeed even if when people were asymptomatic and didn't know they'd ever been infected, you can still get symptoms months later. Or like me, you can never recover from the acute. For me, there was no difference between the initial stages and later stages. Yes, the symptoms have evolved, but I couldn't draw a line and say that's when one phase ended and the next phase began.
What would be some of the most common symptoms if people are listening to this and thinking, maybe that's still affecting me? I
think the fatigue is definitely one of those. And when I say fatigue, this is not just a little bit tired, get a grip, get on with it. It's, I actually can barely lift my head off the pillow. I feel like I've been anaesthetised levels of fatigue. You can just about drag yourself to the toilet levels of fatigue. Cognitive issues are really common. So concentration issues, memory issues, word retrieval, that sort of thing, executive function, planning. The joint pain is another one. Joint and muscle pain, I think, is not necessarily very well documented. Gastrointestinal sickness, diarrhea, digestive issues. Some people are having to be tube fed now because they have lost the ability to swallow, or they can't keep any food down because allergies and intolerances are also very, very common. Shortness of breath, I think, is very well documented, and there can be multiple causes of that. And I think maybe different people have different causes of that. It can be cardiac related. It could be because your diaphragm has got muscular issues. Could be, in my case, it feels like it's to do with tissue hypoxia. So there's increasing evidence that there are microclots in the blood of lots of us that maybe impair the ability of the tissues, the gas exchange in the tissues. And there's also much documented issues with the endothelium, the lining of the blood vessels, which is why it can affect anywhere in the body. But one of my Twitter friends' first symptoms was not being able to comprehend a text message. That was her first symptom. Other symptoms are people passing out.
So it could be, not comprehending a text message. You mentioned this already. Cognitive. I mean, it's the idea. People talk about brain fog a lot, don't they?
Yes, which kind of makes it sound a little bit less sinister than it sometimes feels. But I guess I was just saying, that was her very first inkling that she wasn't well, was not being able to interpret what that meant. And other people's first symptoms might have been diarrhea or joint pain. It's really, really diverse. So I think it's more a combination of, if you've got lots of miscellaneous things happening to you that are very different to anything you've ever felt before quite often, then that, and given the likelihood of probability, the balance of probability during the pandemic that we're in, I think it's long COVID and the duration of symptoms and the relapsing and remitting nature that's common as well.
Okay, you mentioned earlier that NICE have I think, if I'm not paraphrasing you, basically a definition, a recognition of this. Do you feel that understanding of long COVID has evolved, and is it good enough now in terms of, say, let's take the medical establishment to start with?
It is much, much better than it was, because starting from a very low base, given that it was a new virus. So it is much better than it was, and we're very grateful for the hard work that the NHS has put in, and bodies such as NICE. But there are still medical professionals who don't believe patients, or who don't believe that all of their symptoms might be attributed to it. And there are still employers and policymakers are not necessarily as aware of it as they should be. And I think you do have to question why long COVID, which the Office of National Statistics showed using data from the beginning of December, that as of that point 1.3 million people in the UK have long COVID, and that number is set to increase hugely, because we're already seeing people joining our Facebook group from the Omicron wave, and we know how many people were affected by that. So huge numbers of people are affected, and hundreds of thousands have had this for over a year. Hundreds of thousands say that it affects their ability to fulfill their impacts their life and their daily activities a lot, which means losing their jobs, in some cases losing their homes, losing their mobility, losing their ability to function. So it's vast, and considering that, it does seem remarkably absent from a lot of the policy making and public health messaging.
Yeah, so in particular circumstances, how hard is it for someone who feels that they are suffering from long COVID, basically to go to their doctor, to get the medical sign-off, to get maybe their employer to sign them off on sick leave? Does that happen? How easy is it? Do you come across people who can't get through that process? Yeah,
I think it very much comes down to the individual people you're dealing with. So some medical professionals are incredibly empathetic and sympathise as best they can and do what they can to help. Others refuse to really believe that it's a genuine condition, or they refuse to believe that individual patient has, their combination of symptoms could be that. And I think similarly with employers, some are being flexible and understanding, an awful lot are not, and I include the NHS in that. Unfortunately, some people are losing their jobs even when they caught it at work, which is just a horrific situation for people to be in.
Do you understand why some people, even listening to this, might say, oh, well, they're just feeling a bit tired, or there's another condition that predated this, which is the cause of this? Do you understand why people might say that, because this is a new phenomenon?
I guess it's probably human nature to try to think that it won't, or hope that it won't happen to you. So I think there's probably an element of that in people responding like that. And actually, I host a Zoom call every week for members of our group, just a general chat, and a couple of people who turned up the other day. One of them is she's lost 7 stone. So she admits she was overweight before, but she has lost over half of her body weight within the course of a few months. She is waiting to be referred to be tube fed, because she is unable to swallow properly. The little flap of skin that covers your airways doesn't work for her, so if she tries to eat, she risks choking. So she's in a terrible state, and that's just one of her symptoms. So she literally cannot eat. I know of another person, another friend with long COVID, who is also being tube fed for several months. Many of us use wheelchairs now, It's not just, you get a bit breathless going up the stairs and you're a little bit tired. There are others who can't keep any food down, so they vomit constantly, or their sense of smell is distorted. I think it's well known that you can lose your sense of smell, but actually there's a phenomenon where people have parosmia, which is where you have a distorted sense of smell. So everything can smell and indeed taste of something entirely different. And these, for some reason, are never pleasant tastes. So people report things like rotting food, feces, chemical type smells, petrol, smoke. So every single thing you're eating tastes of feces. It makes you vomit and you can't keep anything down. So you think to yourself, oh, it sounds fairly harmless having a distorted sense of smell, but it's massively debilitating, and people can't tolerate anyone in their household cooking things, and they're trying to distance themselves from their families because of it, and so on. So even things that sound relatively more benign can actually be hugely life-changing. When my son has a flare-up of his joint pain and muscle pain, he has to, if he needs to move to go to the loo, he has to crawl, and he can't even crawl on his hands. He has to use his forearms because his wrists hurt so much. He's just turned 13.
I'm very sorry to hear that, I must say. I'm sorry. If somebody is in just some practical advice as we're here, if someone is in a situation where they feel they are not being taken seriously either by a doctor in terms of trying to get this recognised, or by an employer, some practical advice, what can they do?
We have a website, so Long COVID Support is forming a charity, and our website longcovid.org has resources on there for patients and also for employers, and members of our team have co-developed materials with the likes of the Society of Occupational Medicine, who've provided guidelines for employers and employees. There's also guidance on there about applying for benefits, because a lot of people don't necessarily realise that they are eligible to. So things like personal independence payment you can apply for even if you are able to do some work, because being disabled comes at a cost if you're having to try and source wheelchairs or go and get extra help to try to get some symptom relief. So yeah, we put resources on there, but otherwise it's been very much a question of the patient community supporting each other through this, because actually it's incredibly difficult for other people to realise what it can be like.
But you did say there is an official kind of nice definition and recognition now, at least, that this is National Institute of Clinical Excellence, which decides on what money can be spent, to deal with various conditions. That's pretty important, isn't it?
Yeah, so the first one came out at the end of 2020, and then it was recently revised. I think they are very much evidence-based, as they should be, but I guess how you define evidence in something that's so new and emerging and fast-moving is up for debate. And I think there's been some challenges where I think health professionals don't necessarily find it very useful as a way to know what to do when they're referring to that NICE guideline. And so actually there are some very active groups of medical professionals who also have long COVID, who have, 35, I think it was of them, or 34, 35, actually published a paper last year based on a Delphi study where they identified what tests and what investigations could be done in a way of trying to make it more actionable for medical professionals. And I think there's a whole other issue in that long COVID clinics have, or assessment services as they were originally called, were rolled out in England only, not in the devolved nations, throughout 2020. But getting referrals to these is actually very difficult because it needs your GP to believe you, which is less of an issue now, thankfully. But there's also, apparently, GPs tell us that there's a particularly arduous process to refer. So if you're a GP who, as we know, are hugely overstretched at the moment, and you've got a 10-minute appointment slot, try talking about, I had something like 40 or 50 symptoms. So you can't talk about that in a 10-minute slot.
40 or 50 symptoms? That seems an extraordinary number.
Well, yeah, it is. And that, anything from tinnitus to internal vibrations to joint pain, muscle pain. Literally, there's over 200 in all, but I think I've counted 40 or 50 myself over the months.
Oh, well, I'm very, very sorry to hear all of that. Let me ask you a slightly different question now, which is, there is a sense that, maybe the country is through the worst, moving on. Omicron has not proved, we think, to be as dangerous as we thought it might be. When you get that sense that maybe the country, the government, the powers that be are trying to put COVID behind us, how do you feel about that?
I think it's really tricky. I can completely sense that the public is very tired of the pandemic. We would all wish we could wave a magic wand and it'd all go away. So I get that there's a balancing act to be struck, but as I mentioned earlier, I think long COVID is actually notably absent from a lot of the policy making and public health messaging. I've sat on the NHS England Task Force and the Department of Health roundtable since they were set up in the autumn of 2020, and as I say, I'm very appreciative of the hard work that people are putting in, but long COVID is not talked about as much as it should be, considering it can impact anybody of any age, and the risk, it's really not known who will get that. So Omicron, I got Omicron myself, as did my entire family, and thankfully the actual initial illness was mild in our case, and so far, it's only been a month, but so far I've reverted, as I have my children, to our long COVID baseline, as we call it, that we were like before. But we are seeing larger and larger numbers of people looking to join our Facebook group, our long COVID support group, who fell ill during December and since then. So some people are experiencing very much the same symptoms that those of us who fell ill in the first wave did. So be that joint pain, tremors, fatigue, cognitive issues, pain, etc.
You mentioned that you didn't think long COVID was being talked about enough. I mean, do you think that the government needs to put more money into research or more money into care for people suffering from long COVID, or just needs to be more aware of it all?
All of the above, but I do think it needs to be more prominent in public health messaging, because I think there's a certain assumption, I think, that if you've had your vaccines and if you're young or if you're healthy, that you'll be okay, and that is absolutely not the case. So many people who've been triple vaccinated and indeed have caught it before, so have natural immunity as well, are being reinfected and are then developing long COVID. So it's anybody can get this. Even babies are struggling to recover from this. So and I was just at Independent Sage earlier, and they were showing the data, the ONS data, that shows a huge rise in school-age children. So although cases have peaked in the older age groups, they're still rising in children and the staff who work in schools.
I just want to be clear, you still think people should be vaccinated though?
Absolutely. I do think, and I do, the statistics show that being vaccinated and boosted does offer protection, especially if you've had your booster. I think it's less the case if you've only had 2 doses of the vaccine against Omicron. And of course, there are these subvariants of Omicron that are starting to circulate and have become dominant in places such as South Africa and I believe Denmark and some other countries, which have even higher transmissibility than Omicron. So even though the illness may or may not be mild when you first get it, you can still get long COVID from asymptomatic illness in the first stage. So people need to be aware, and I completely get that there needs to be a balance between people, quality of life and mental health and being able to work and all that. But I think the messaging should still be, work from home if you can. I think masks and protections should be in schools and public places. I think we've wasted an awful lot of time that we could have been using to vaccinate people sooner. We still don't see vaccines in younger children, which is where the case numbers are rising hugely at the moment. And it's starting to spread to their parents' age as well. So I would be vaccinating even young children, and I would be keeping the mask mandates in place. But we've missed a massive opportunity, and it's never too late, but we should have done it months and months ago, is to invest in adequate indoor air quality systems in public buildings and workplaces, public transport, etc. In the same way as the sewage system came in and kind of helped combat cholera, we need to absolutely invest in our buildings, because that will help not only with COVID but other airborne viruses.
I think you mentioned earlier it was a figure of was it 1.3 million that you think? Yeah, so 1.3 million people with some form of long COVID. And as you say, off the back of Omicron, we may well be adding to that. I mean, that's potentially a pretty big cost to the NHS, isn't it, if we're going to be dealing with that effectively?
It's a huge burden to the NHS. And I think people, a lot of government policy has been, save the NHS, protect the NHS. But they're only thinking about that through a very narrow lens of intensive care beds, actually. And we've seen I think in the more recent wave that it wasn't necessarily the ICUs that were filling up as quickly as the COVID wards, but what isn't being taken into account is the burden on the NHS generally, so whether that be primary care, community care, across the spectrum of the NHS, of long COVID. The burden is enormous. And people are not, the waiting lists are huge. To get to a long COVID assessment service, it's absolutely normal to be waiting 6-9 months. And even when you get there, they don't necessarily know what to do with you. If you have certain symptoms that can be treated, that can be alleviated, then you might be lucky. But many people, they just get offered a bit of physio, which often is actually contraindicated because a lot of people with long COVID are intolerant to exercise and it causes enormous flare-ups in the way that it does with ME. So we urgently need more investment in research, and we urgently need a different approach to research. It's taking too long. One of the big studies that was funded by the NIHR took, I think it was 9 months to get going because of all of I understand there are protocols and ethical approvals and contracts or whatever else needs to be done. But apparently that was fast-tracked, and it still took 9 months before anything was able to start. And that's one of the ones that after it had been awarded funding, never mind the time it takes to apply and all of that stuff. So I don't know whether we need to learn from the world of software development, where we talk about agile methodologies and sprints and all that stuff, to really disaggregate the process. And I think we need to be giving long COVID research the equivalent of the urgent public health status that we saw for acute COVID and with the vaccines. Why aren't we seeing the absolute laser focus on we need to absolutely solve this problem? We need to prevent more people getting it, which we're not doing anymore, and we need to help those who've already got it as soon as possible. We need people to be looking at administering antivirals. As soon as somebody falls ill, you should be able to go and get a combination antiviral as an oral tablet to stop the replication, which would keep you out of hospital and would hopefully prevent any long COVID as well. Why aren't we hearing about that and seeing it in the way that we should be?
It sounds like, and you've been obviously very much involved with this for, nearly 2 years now. In all that time, what has been your sense of government in terms of dealing with this? Do you have any faith that it will be dealt with properly in the short term and the medium term?
As I say, I'm very grateful for the clinics that exist in England. Much more needs to be done in the devolved nations. Much more needs to be done with children. They do have paediatric hubs that were rolled out. They've got 15 of them, but children in particular are completely overlooked in this because the myth was for so long that children don't get this, which is absolutely not true. So yes, there's been some measures in place and they've put around 50 million into research, but that compares to $1.15 billion in the US. And the studies that were funded in the UK, a lot of them are observational studies telling us about what our symptoms are. They are not focused on the absolute critical path of looking for what's causing this, so therefore what might we be able to do to treat it. So I think money's going to some of the wrong places. In fact, earlier today I was horrified to see that there has been a study that's been funded, which is £1.5 million, looking at the efficacy of different types of masks for healthcare workers, when it's long been known and proven in multiple research studies, and the World Health Organization and so on has announced all this, that they need to be wearing FFP3 masks or respirators if they're dealing with people on COVID wards. So this study's been funded, it starts in February, for £1.1 million of our public money going on a study which is surely completely unethical, because the control in the study is where the healthcare workers would be wearing only surgical masks, which have been proven in other studies not to stop people catching COVID and long COVID. So that is an absolute crime, frankly, that our money is going for something that's actually dangerous to the participants and will not tell us anything that hasn't already been shown elsewhere. We need people to be looking under microscopes and looking at the genetics and immunology and microclotting and autoimmunity and persistent virus. These are the areas where there's enough evidence that that's where you should start digging. We don't need people doing these useless studies. And there's another one that's looking at obesity and long COVID. And we know that there was a correlation between obesity and people in acute COVID, severe acute COVID in ICU, but there's absolutely no evidence of that in long COVID.
Do you fear that you're never going to be free of this, that your children are never going to be free of this?
I'm an optimist by nature, and so even if we are never the same as what we were before, I do feel that we can have a decent quality of life, although, if you list some of the things we're living with, then it does sound pretty awful. One thing I haven't touched upon, and which is completely unknown, are the long-term implications of any of this. So whether that's long COVID or even having recovered from acute COVID without the persisting symptoms, we don't know what that will do to us in the future. So does it make us more susceptible to other conditions? So we know after the Spanish influenza, for example, I understand there was a big wave of Parkinsonism, for example, that came on some years later. So that's something which is a huge unknown. We see in our Facebook group that there are signs of people having early menopause, even children having issues with their menstrual cycles and issues like that. We see people who are losing pregnancies, and apparently that's and their midwives tell them that they've seen a much greater incidence of people losing pregnancies than they had done before. So I think there's all sorts of other conditions that are not yet publicly known, but we're seeing the early signs of. And we know, for example, that diabetes is something which is associated with long COVID. So I think we're going to see a huge wave of related conditions. And we know that other viruses are activated by COVID as well. So we're seeing a lot of people with shingles and reactivated Epstein-Barr virus, which causes glandular fever. So there's all sorts, we are not just static, it's not we're not just all on a road to recovery here. Lots of people are actually getting worse, even though they've had it for a long time. And that's before we know about any other things that might come down the line and our ability to fight against other conditions that we might catch.
And this is the final question. Do you fear that people like you will be overlooked and just quietly sort of put in a box if we kind of decide that we've gone beyond COVID?
That's been my fear from the outset, and it's something that I've fought very hard against. But there are huge numbers of us, and a lot of us are of our working age, a lot of us are of a voting age. And I think some people are losing patience and talking about protests to the extent that they're physically able to do that, or getting people to go in their place. So I think there's a lot of emotion out there when people have lost their livelihoods and in some cases their homes and their relationships, and they literally cannot look after their own children, for example. There's an absolute desperation. A lot of people are suicidal, so they will do anything to get the care they need. So I do continue to believe that it's not talked about enough, and I think there are probably policy reasons for that, but we will not be going away. And with the power of social media, we are in touch with each other, and we can mobilise.
Claire Hasty, I wish you and your family all the very best, and thank you very much for talking to us.
My pleasure. If anyone needs any resources or information, head to longcovid.org.
Claire Hasty of the Long COVID Support Group, with a plea that we do not forget those who will continue to live with this condition, possibly for years. If you have thoughts on this or ideas for other podcasts, you can email me on andy.bell@itn.co.uk, and I'm tweeting it at andybell5news. And please share, rate and review. Thank you for listening to this edition of How Did We Get Here? There'll be another along soon.